In Utah and across the nation, we have seen the rise of an opioid epidemic that continues to explode exponentially. It is a topic we've been uncomfortable discussing, but it's clearly an issue that must be discussed and addressed. There have been a few legislators locally and nationally who have tackled the opioid epidemic head-on, and we applaud their efforts. We also recognize that there is much more that needs to be done. In some ways, America's approach to the opioid problem is similar to the famous poem written by Joseph Mallon in 1895, titled "The Ambulance Down in the Valley." You remember the story of the tiny town which boasted of a mountain lookout with magnificent views of the valley. While the scenes were spectacular, the cliff was unacceptably dangerous. Many local citizens and passing visitors alike had tragically fallen from the cliff to the valley down below. Some of the citizens in the town advocated for putting a fence around the cliff, but others more persuasively made the case for simply parking an ambulance down in the valley. For the cliff is all right if you're careful, they said, and if folks even slip and are dropping, it isn't the slipping that hurts them so much as the shock down below when they're stopping. So day after day, as these mishaps occurred, quick forth would these rescuers sally to pick up the victims who fell off the cliff with their ambulance down in the valley. So the citizens relied on the ambulance to deal with the ever-present and potentially lethal problem. Then an old sage remarked, "It's a marvel to me that people give far more attention to repairing results than to stopping the cause when they'd much better aim at prevention. Let us stop at its source all this mischief," cried he. "Come neighbors and friends, let us rally. If the cliffs we will fence, we might almost dispense with the ambulance down in the valley." So as it relates to our opioid cliff, we have added many new tools to the ambulance down in the valley, including vital overdose reversing injections, needle exchanges, counseling, and rehabilitation programs for those who have become addicted. Unfortunately, we have done far too little to build the fence at the top of the cliff. And so it's time for a fence-building discussion between families, churches, legislators, doctors, healthcare providers, and drug companies. The opioid cliff is but one ledge where we would be wise to focus more on fence building instead of ambulance production. Many of our state and federal programs designed to deal with things like poverty, homelessness, long-term unemployment, healthcare, and hunger have spawned fleets of ambulances parked in the valley of government assistance. As James Mallon concluded, "To rescue the fallen is good, but 'tis best to prevent other people from falling." So we must get better at building fences in our communities and, when appropriate, through government. In areas where we lack effective solutions, it is usually because we are avoiding uncomfortable conversations. The conversations that lead to good fences. For Sutherland Institute, this is Boyd Matheson. Thanks for engaging, because principle matters.